I think it's quite important. We have an aging population. We almost have doubled our aging population over the age of 65 in the last 40 years. So I think it is becoming increasingly problem to have a workforce which is trained specifically to deal with the older patients with cancer. I think is actually quite important, and I don't think so one course in Europe is enough to actually train everybody in the world. So I think with the two biggest older patient population, Japan and Australia, within the top 5 countries, I think it's quite important that we do have a course in Asia Pacific region. And I think I think with the opportunities, I think Australia is a good target in terms of the Asia Pacific region. As I said before, I think aging population does have a lot of health needs, and I think if you manage them well, if you can keep them from the hospital, if you can keep them a few years away from a nursing home, or if you can actually manage them well and give them the best optimal care, you're actually ultimately at the end of the using less healthcare revenue and ultimately providing a lot better health services for all the population. So all the money saved from there could actually be utilized on the public health campaigns and trying to decrease the incidence of cancer and other communicable diseases. My personal view is that if we can train another 40 or 80 people in this region who can actually go out, who can actually go back and go to the institutions and take the message that we need to have a specific directed services, we're going to create a lot more awareness, a lot of public voices, lot of lobbying in terms of the more funding that we actually need for these patients, and to have a specific targeted service which needs to be developed. So I think the more the people we train, the more better we have and more voices we have, just not the people who actually have got an interest in this field.